Hi, my name is Dr. Raza Jafri. I'm a board-certified anesthesiologist and a pain specialist. Welcome to Balanced Ketamine.
Hi, my name is Yana. I'm a certified medical scribe and aspiring physician. We understand that there's a lot of stigma around ketamine infusion therapy, and so today we want to address it. I will be asking Dr. Jafri some questions about why there's this stigma and how you can tell your family about ketamine infusion therapy and just addressing the situation as a whole. So my first question is, why is there so much stigma around ketamine infusion therapy, Dr. Jafri?
I think there's a lot of stigma around any medications because of the opioid epidemic, because of the pharmacological world we live in, and ketamine also has certain street use that has brought in a lot of stigma with it. People often confuse ketamine for opioids, and opioids have a reputation to be addictive, causing a lot of social and community issues. So that's why ketamine has a stigma attached to it.
Thank you. And so how is ketamine used at our clinic and medically in general?
Ketamine is used in our clinic in a very calculated dose, in a very controlled environment where patients come in and it's given under the supervision of a physician and a nurse. The dose is very precisely calculated and very precisely delivered, so it's very effective and there's a very, very low risk of being abused.
What are the conditions that ketamine treats?
Conditions that ketamine treat most commonly that it has been approved for recently is depression, but people use it off-label for use in PTSD, chronic pain, anxiety disorder, OCD, and other neuropathic and mental health diseases.
Thank you. And so my last question is, how should a patient tell their family about ketamine and the infusion?
There are many ways to bring it up. I think that the best way to do is to have an open conversation with your family member. I explain to them what you're going through, your symptoms of depression, and then bring up the history of ketamine, how ketamine was initially introduced as a hypnotic agent to be given as an anesthetic, but recently, the last 20 years, has been approved and used for treatment of depression, and now it's being used for other uses. And then you can speak to your family about the neuroscience and the biology of ketamine and how it works on the NMDA receptor. And finally, you can mention the fact that you're going to a clinic where the physician is giving a very calculated dose to help you fight your depression or your mood disorder, and it's done in a very controlled setting, so the risk of becoming addicted to is very, very small. And also bring up the fact that there's a very, very small chance you will be abusing this medication. So those are all the ways you can bring up the conversation with your family, which makes your family more comfortable with you and reduces the likelihood of having a stigma.
Thank you so much, Dr. Jafri, for answering all of our questions, and thank you for watching our video. If you have any questions specific to you about ketamine, you can visit our website or you can call our clinic. Both are which linked below. And thank you so much. Have a great day.
Thank you.